Welcome. I'm Ken Ellenbogen from Virginia Commonwealth University in Richmond, Virginia, and I am the program chair for Heart Rhythm 2023 in New Orleans. And on behalf of myself and my colleague, Dr. Mina Chung from the Cleveland Clinic, who is our abstract chair, we want to welcome all of you to New Orleans in May. The most exciting thing I think this year about the meeting, aside from the great science, the great location, is the fact that people are coming back to medical and scientific meetings. Our expectations are that this May in New Orleans at HRS 2023, we will have over 6,000 attendees, and we will be back to pre-pandemic levels. I'm really excited. This is the 44th annual meeting of the Heart Rhythm Society. And because we've not been meeting in person for a number of years, I think we're going to have the best science we've seen for several years. I'm going to ask my colleague, Dr. Chung, if she wants to comment about the abstracts and the late-breaking clinical trials this year.
Thanks, Ken. I'm really excited about getting together with everyone as well. And it's going to be wonderful because as opposed to the last 2-3 years when we've been mostly virtual or hybrid, I think most of our registrants now are planning on coming in person. So that's really exciting. Yeah. And for regular abstracts, we got over 2,500 submissions, which is a 24% increase compared to last year. And we got a lot of late-breaking abstracts, late-breaking clinical trial, and late-breaking science submissions. That was a 39% increase over 2018. So that's really exciting. We're going to have 6 late-breaking science, late-breaking clinical trial sessions, and also some that won't be in those oral presentations will also be in a couple of extra special sessions where they will have posters, and we'll also be, offering webinars with their material as well, along with the actual oral late breakers that will be recorded for everybody. So I'm really excited about the science that we're going to see, as well as being able to see all of our colleagues.
Yeah, I've been on the program committee and involved in HRS programs for a number of years, and I can't remember the last time I saw as many exciting late-breaking clinical trials, and I know you had a hard time selecting the best ones. I'm really looking forward to seeing them presented and hearing about all the new clinical trials and new clinical technologies. It's going to be very exciting. In addition, because of
studies too, so that's really going to be exciting for the innovations.
And Mina, you and I have managed to sort of create a program so that unfortunately not everybody in our field will be able to attend. And there will be some opportunities for people who, for whatever reason, can't attend in purpose to have access to both live streaming and on-demand sessions. They will be able to participate even in some real-time question and answer sessions as well. So this is going to be a really blockbuster year. I have to say that some of the sessions we're having this year that I'm super excited about are some amazing hands-on sessions where we're going to have people who develop techniques such as CO2 insufflation in the coronary sinus to get epicardial access and ablation for patients who have refractory neurally mediated syncope. Some of the developers of the techniques who will actually showcase sort of how to do the technique and go through it step by step, who to perform it in, how to perform the technique, how to troubleshoot the technique when it's not going well, and then show some short videos on how they actually perform the technique. This is that new content that we've developed, and it's, I think, a really unique way to learn from the masters who develop these new techniques, how to do the technique yourself. So I'm really excited about that. In addition to late-breaking clinical trials, I think that's going to be unique and new. you might want to say a word about some of the guidelines that are coming out at this meeting, because you've got to be excited about that too.
Yeah, we've been working on the cardiac physiologic pacing guideline, which is HRS's first guideline. And it will be launched and released during HRS 2023. There'll be a session on that. They'll keep you up to date. It'll cover new recommendations on cardiac resynchronization therapy, biventricular pacing, as well as conduction system pacing, his bundle pacing, and left bundle branch area pacing. So really excited about that. It took us a while to get through with the pandemic. It had to be a little delayed due to a lot of priorities that we needed to deal with the pandemic, but it's coming to completion. So really excited to see what everybody thinks about that.
And I want to make clear that on top of all that, we both want to make clear that we are welcoming everyone in our scientific community. And that includes all the amazing people who work with us, the nurses, the nurse practitioners, physician assistants, people who work in industry, who often work side by side with us in the lab, who help run the computerized mapping systems or aid in device implants. There are going to be 11 different educational categories, and there are going to be over 200 sessions with 1,500 faculty coming from all over the world. So there is going to be more than something for everyone who has any interest in electrocardiography, in clinical electrophysiology, in invasive electrophysiology, in ablation, pacing, lead extraction, the new aspects of computerized assessment of electrocardiography, modeling, basic scientists all over the place. We're super excited. In fact, there will be a tribute to Mike Rosen, who unfortunately passed away several months ago, to the great body of scientific work that he accomplished. I'm also excited about the opening session. It's going to be an amazing, amazing presentation by one of our own, Dr. K. Shiv Kumar from UCLA, who's going to talk about cardiac anatomy for the electrophysiologist and his journey to really the first atlas of anatomy for electrophysiologists that will be available to every electrophysiologist anywhere in the world. And he'll go through how he got to where he did to be able to release this amazing piece of work that I encourage everyone who's listening here to find out more about it. And anyone who's interested in cardiology should get a copy of this atlas. So we both really encourage you to do that.
We're going to have a lot of special sessions too. There'll be a women in EP luncheon, and then there's going to be presentations to awardees, not just Young Investigator Awards, but we also, there's something very special this year where we have a task force that has been working on how we can give back to New Orleans, Louisiana. So there will be a couple of organizations that you all have donated to, and will present your donations to them during this scientific sessions.
So it was through both of our efforts that we brought back this year. You're going to be very excited to hear this. Real posters, Back to the Future, the way we used to do it, where people will be at poster boards, the presenters, and you can walk by and stop and talk to them. We have over 120 industry partners, and there will be the opportunity for both fellows and our associated professionals, nurses and PAs and nurse practitioners to have an experience doing mapping, using the mapping systems to do simulated mapping, to do programming, to learn how to program with the different programmers. So there are going to be amazing opportunities for people to get hands-on through both educational experiences and through in the exhibit hall, which is going to be packed with new technologies and our industry partners, and an opportunity to learn so much about some of these new technologies.
Yeah, those hands-on sessions are going to be really popular. They were really popular last year, like standing room only, and they limit the number. So if you know, especially the fellows, are open to fellows, and you know, early career, just if you have the opportunity to sign up for them and you want to go to them, you should sign up so you can save a spot.
So 2023, without question, is a time to get back in person, to be back in New Orleans, and to be rubbing elbows, maybe not rubbing elbows, but at least to be able to speak to your colleagues and your friends and your colleagues who are in the industry and who you work with, but maybe don't get an opportunity to see from all over the world. From all over the world, have this opportunity to reunite friendships and reunite collaborations. We really, both of us, encourage you to come visit us. We'll be there. We'll be looking forward to seeing all of you. And I'm sure your friends will be there too. So let's make 2023 a great annual scientific sessions. Thank you.
Thank you.